So like fillers are from long back and they are very safe, hyaluronic acid.
Have a doctor who's guiding you properly. That's very important.
There are roughly 7 types of collagen in our skin only.
If I'm under stress, my hair, my nails, and my skin, all three get affected very drastically.
That's why I prefer to give combination of treatment when it comes to the holistic phase, right?
Once you get this done, I don't worry about what people think because I think it's a beautiful thing.
So-
what about those hyaluronic acid tablets? और आजकल की actresses को मैं देख रही हूँ, they all get these pillow faces by doing excess and doing too much. Now what I did was correcting my feature, not changing my feature. Does rice do anything to your face?
Actor, we have Shah Rukh Khan, we have a lot of A-listed actors, right? And they're doing it from long back. They're not started just now.
Correct.
वो बहुत पहले से ये कर रहे हैं. Hi everyone, I'm Dr. Mohammad Asif from Kara Hair Transplant and Aesthetic Clinic. And today, this podcast is about aesthetic truth. So, as the name suggests, the aesthetic truth means we are going to figure out what are the aesthetic things are going up around the world, what are the myths, and we are going to decode a lot of things related to the aesthetics. And for that same thing, we have invited our first guest, Divya Agarwal.
Thank you so much, sir.
And as everybody knows who she is, so she's an actor, she's a model, she has been to many web series, and she is having a lot of projects which are coming out, and hopefully she's going to tell us all about it. So we are going to start this podcast. Are you excited?
I am so excited. First of all, congratulations and all the best for the podcast. I think this was very much needed क्योंकि एक एस्थेटिक क्लिनिक को या ऐसे भी किसी क्लिनिक को जाना सब चाहते हैं पर एक वो बोलते हैं ना टैबू है कि किसी को बताना नहीं है, हम कुछ डिस्कस नहीं कर सकते हैं. तो it's nice to see a clinic doing this.
Correct. I think I'm super excited to do this. For me, the purpose is to give honest opinion
Correct.
related to the aesthetic world and see everybody wants to do something in aesthetic.
Correct.
They want to change their appearance. As you know, we are aging, everybody age, right? And they have to go back to the some years before. And that's
Correct.
much important in career,
Correct.
especially. And nowadays, because the world is going very fast,
Correct.
even aging is also happening very fast. I've seen people at 20, 25, 30, they have signs of aging, right? Which is coming out that early.
Correct.
So which can be easily preventable as well.
Correct.
So we're not only just guiding them that do go for some sort of treatments, you can also do some sort of preventive care so that you will not get them early.
That I've experienced in Kara, like whenever I speak to Dr. Alina. So I have this thing. Ma'am, ये थोड़ा और ये कर लेते हैं, ऐसा कर लेते हैं. She's always been telling me, no, Divya, this much is needed. This much is what we'll do. And rest, she's always told me, यहाँ पे तो जो हम करते हैं वो करते हैं. You have to finish your homeworks. She gives me homeworks, okay, like a skincare routine, like a hair care routine, and she would give me some products from herself that you have to use this, Divya.
Yeah, and she's very much right because this is like a holistic approach.
Correct.
Right? You cannot just rely only on treatments to get yourself at a certain position. आपको changes करना है. आपको अपनी skin को हर year, हर month आपको analyze करना. It's just like every day we are going through some phases and कोई भी स्ट्रेस इवेंट हुआ उसकी वजह से भी चेंज आ रहा है.
Correct.
आप देख के देखिए, आप सोए नहीं दिन, आप फेस
Yes.
से पहले देखिए.
Yes, if you don't sleep, सबसे पहले तो आपकी फेस पे भी दिखता है और बॉडी पे भी काफी दिखता है. Bloating काफी ज्यादा दिखती है.
Yeah.
You look tired, your under eyes go in.
Correct.
Okay, your lips are dried.
Yes, yes.
तो वो सब तो शूट बेसिस पे तो कभी अफोर्ड ही नहीं कर सकते हैं वो सारी चीजें. That's why we have to take care of. And जो टेक केयर भी है वो इतनी बेसिक है. When you actually come to know about it, it's so basic that you have to just sleep early, wake up on time, and workout, especially for me, I say, is a plastic surgery. It transforms a person, it changes a person because of your blood. तुम्हारा blood pressure सही हो जाता है, everything comes in place. So ये सब तो है ही हमारे हाथ में. And then the clinics like Kara, they come in place. to help us
Yes,
to do even better.
that really helps. I think this information which you're giving out, and I think as you go further, we're going to decode many things.
Right? Let's
So
do
I'm
that.
going to start with the first thing. What made you to enter into the aesthetic industry? That's the one thing.
I'm very glad that my approach towards the industry since childhood was never driven by beauty or glamour. But we all know that it's a very, very important aspect, right? So when I got into it, I thought कि यार मेरा तो सब सही है, मैं सब सही कर रही हूँ, सब सही चल रहा है. But as in the time went, the insecurities started building up when the directors or someone from the crew or anything, they would correct and they would say कि like मतलब there was this one issue always with me with my teeth.
Okay.
I have a little मेरे बाहर है
Really?
teeth. हाँ, yeah.
That's really good.
तो उस वजह से I used to get very conscious earlier, doctor. तो that I tried to fix it, but then something called me in my head that I should not fix it. And today it is my smile is one of the best smiles that I could do. Yeah.
See, just one change if she focused on, and that brings not even only just the confidence, it also gave the career growth as well.
Correct.
So
So I never thought about this journey that much, but as an event, I went to Miss India. मिस इंडिया में सबसे ज़्यादा जो बोलते हैं ना एक जो फोकल पॉइंट था वाज ऑल अबाउट ब्यूटी एस्थेटिक्स एंड टेकिंग केयर ऑफ योरसेल्फ एंड स्किन केयर सो देयर व्हाट आई लर्नड एंड इट वाज नॉट टॉट टू अस इट वाज माय ऑब्जर्वेशन दैट makeup and everything will obviously make a person look very amazing, okay, but if you have the correct skin, if your skin is right and prepared, then makeup हो no makeup हो the whole conscious part of मैंने आज makeup नहीं किया मैं बाहर कैसे जाऊंगी is a lot of girls do that is that goes out of the block कि अगर तुम्हारी स्किन अच्छी है ना तो फिर वो मेकअप हो तो वो और एनहांस हो जाएगी
Correct.
और नहीं भी हो तो भी बहुत अच्छी लगेगी.
yes, so जैसे एज है, मैं समझता हूँ कि यू बीन टू टीनेज एज वेल, राइट? सो वहाँ पे एस्थेटिक चैलेंजेस वर डिफरेंट एंड यू वर एंटरिंग इनटू द इंडस्ट्री, करेक्ट? एट द सेम टाइम, सो हाउ डिड यू लाइक मैप्ड आउट योर करियर, लाइक मुझे मॉडलिंग में जाना है, मुझे उधर जाना है, वहाँ पे फेस का रिक्वायरमेंट क्या होना है, ये डिफरेंशिएट करता है, पहले तो मुझे ये भी जानना है थी. यस,
जब पहले स्टार्टिंग में मैंने ज्वाइन की थी इंडस्ट्री आई ज्वाइन एज अ कोरियोग्राफर. मैंने डांस कोरियोग्राफी से चालू किया था. उसके बाद फिर बैकग्राउंड आर्टिस्ट का काम किया है. उसके बाद मैं कटरीना कैफ की बॉडी डबल थी काफी प्रोजेक्ट्स में. देन
most people know about it.
yes not many
Then
so it's been 17 years so I have like 17,000 stories related to this career because क्या होता है सर हमारी इंडस्ट्री में इट्स नॉट लाइक अ मंडेन लाइफस्टाइल दैट आप सुबह उठो और आप काम पे जाओ और वापस आओ. सो द स्टोरीज आर नॉट मच क्रिएटेड. हमारे यहाँ पे जैसे क्या होता है हर दिन नया, हर सुबह नहीं, हर दोपहर नहीं, हर शाम नहीं. देयर इज नथिंग दैट वी कैन से कि ये तो सेम वैसा ही दिन था. पर उस चीज़ में उस दौरान में सबसे ज़्यादा चैलेंजिंग ये होता है कि तुम्हारी जो रूटीन लाइफ है वो इतनी ज़्यादा डिस्टर्ब हो जाती है शूट के वजह से वेर योर स्किन हेयर एवरीथिंग गेट्स गो फॉर अ टॉस.
yes. So you got a lot of information how you can prepare yourself if you are entering into these fields.
No, it's preparing is just sir मतलब जैसे when how I started it was like I knew what I wanted to do. मुझे पता था कि मुझे एंटरटेनमेंट इंडस्ट्री में जाना है पर वो उसमें कैसे जाना है कोरियोग्राफी से ट्राई किया, मिस इंडिया से ट्राई किया, हर जगह से जहाँ से हो सकता था ट्राई किया बिकॉज यहाँ वहाँ देख देख के. तो that's how I'm here today and it's you can see a little bit of luck.
Yes.
Lots of hard work.
Yeah, hard work as well. I believe that. Now I'm coming to more specific question,
Correct.
and which can be like related to these two other industry. Like
Okay.
we are into the aesthetics, and the entertainment industry, right?
Correct.
I see people enter into the modeling. That's the one one part there to be. Then the acting thing is required. But the acting
Correct.
requirements are different, right?
Correct.
So. Like, do the directors tell you, or how do you get that information that if I be a model, I should have my features aligned through different set, like in top model look, which is say high cheekbones,
Correct.
by
Correct.
getting a proper jawline shape.
Correct.
and sort of features which you have to manage: sharp nose,
Correct.
lips, volume, right? When it comes to more like an actor, as an actor, I believe more natural face,
Right.
having some volume on the face, right? Which should be more be appropriate to your younger, to your age, more grounded basically.
Correct.
So these challenges happen. If somebody into modeling, they have to prepare themselves differently.
Correct.
You mentioned
Yes.
India,
Yes.
you were there, right? So you know how challenging that it
Correct.
will be, right?
Correct.
So it's just true, like this
It's
happens.
true. It's true. But also, it's also true that there is space for everyone, and there is बहुत जगह है यहाँ पे इंडस्ट्री में, भले वो मॉडलिंग हो और एक्टिंग हो. पहले तो लोगों को ये भी कंफ्यूजन होता था कि मॉडलिंग और एक्टिंग वो एक ही समझते थे. There's a huge lot of difference. Okay, and in modeling also there are different types of models. There are some models they're only for hands and feet. Only hands and feet model for jewelry shoots, for all of those things. There are only skin models also, जिनकी skin naturally ही बहुत अच्छी है. So then, people approach them for beauty products or skin products. तो ऐसे करके there is जगह for everyone. But कई बार ऐसा होता है ना सेट पे, पर जैसे मेरी जो पहली वेब सीरीज थी रागिनी एमएमएस, उसमें वहाँ पे मेरे जो कैमरामैन थे उन्होंने मुझे कहा था कि जब भी जैसे लाइट सेटअप होता है, मेरा नेचुरली जो बर्थ बाय बर्थ ये है ना, जो ये अंडर आइज का इशू है, इट इज अ लिटिल हॉलो. इट वाज माय फादर्स आल्सो वाज लाइक दिस, सो दैट्स व्हाई आई आल्सो हैव इट. मेरे बचपन के सारे फोटोज में आपको दिखेगा. उसमें जब लाइटिंग करते हैं ना, तब जब सामने से लाइटिंग हो ऊपर से उनको 15-20 मिनट एक्स्ट्रा लगने पड़ते थे, जस्ट बिकॉज देन व्हेन लाइटिंग वाइटिंग हो गई, सब सेटअप हो गया, देन दे कॉल मी, दिव्या आ जाइए आपका शॉट है. जब मैं शॉट देने आती थी तब दे हैव टू अगेन एडजस्ट द लाइट फॉर 15-20 मिनट्स. उसमें टाइम बर्बाद होता था. तो मैंने उनसे पूछा था क्या हो गया. कुछ नहीं, आपकी ना अंडर आइज हॉलो दिख रही है. तो उन्होंने मुझे कुछ ये नहीं कहा कि खराब है या अच्छा या नहीं है, पर उस टाइम पे जो कैरेक्टर की रिक्वायरमेंट थी, आई वाज द मेन लीड ऑफ द शो, दैट हैड टू बी लाइक द एक्ट्रेस हैड टू लुक फ्लॉलेस, द एक्टर हैड टू लुक ब्यूटीफुल, ऑल ऑफ दीज थिंग्स. हाँ, अगर ऐसा कोई रोल है जिसमें द रोल इज वेरी रगड एंड इट डजंट डिफाइन the woman into the aesthetical beauty, it defines how she is, how her character is, how her behavior is, तो फिर भी चल जाता है. फिर जब आपको ग्लैमरस या ऐसा कोई आपका कास्टिंग का जो मेन रिक्वायरमेंट ही यही है, उन सब चीज़ों में देन आपको लगता है कि आपको करवा लेना चाहिए. दैट वाज द टाइम व्हेन आई गॉट माय फर्स्ट फिलर डन. माय फर्स्ट अंडर आई फिलर आई गॉट डन. And trust me, I'm so scared of needles. Dr. Alina knows very well. I'm always yelling, screaming. But it happened pretty well and it gave me good results. But उसमें भी क्या होता है ना सर, आजकल की actresses को मैं देख रही हूँ, they all get these pillow faces by doing excess and doing too much.
Okay.
Now what I did was correcting my feature, not changing my feature.
Correct. So you are like, because you understood how it works, and it's very important for everybody, even but not the doctors, the patient should also educate themselves
Correct.
how much correction they actually require, so that they'll not just go for them to maximize this thing, right? So what happens if they try to add on more to it, and sometimes they feel that it will work and doesn't work.
It doesn't.
So I'm going to talk about here the problem which you mentioned, which is the sunken eye specifically. So the cause for sunken eye is
Sunken eye.
sunken
Okay.
eye is basically sunken eyes with the dark circles, some of the theater of problems. They all are similar terms, right?
ये जो एक बैग जैसा जो होता है आंखों के नीचे, what's that?
That's the puffiness. That's
Puffy.
puffiness, right? So that you guess because of the water retention, there are a lot of things which we discuss, like poor lymphatic drainage. The water is not going out from the under the eye area. So all these things make that eyes puffy. Your routine also add on to it. Certain diseases also cause the puffiness of the eyes, but not usually, right?
Right.
They're very rare. So we don't go for the diseases first. So usually see how long this is. So you mentioned it's from long back family history. So purely it's more genetic.
Correct.
Sometimes related to the age as well. As we age, there's a volume, there's a fat which
तो
drops.
यहाँ पे जब वॉल्यूम आ जाता है,
Correct.
then this looks even this is
So that's why you have in a youthful face, you see this is more fuller look, right?
right.
As we age, this goes down, 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 and starts seeing the lines.
Then you start
Sagging. So that's a part of the natural sagging. In some cases, usually it comes after 35, 40s and everything. But every genetic disorder can come in an early age. That's so sure. So let's say balding. Earlier it was supposed to happen post 35. Now it is
Now it's very बचपन से लोगों को वो काफी
15, 16, 18. They are getting hair thinning issues. Some of them are getting bald as well, significantly bald, right? So these genetic disorders, if they're in the family, right, it can come at early age as well. Definitely, there are certain triggers which cause this, like stress, your lifestyle, your habits. They cause them to come early. So theater of, again, as I will stick to the theater of here. Theater of basically the dark circles, sunken eyes, they because of the less volume there. And we have to enhance that volume here. And filler is the blessing. So you did the right treatment. You injected filler just to fill that in.
just to pull this
The small
base
portion.
यहाँ पे.
Yes, correct. If you're going to do it too much, you want to get more of the volume on the
Right.
cheeks, want to lift them just with the fillers. No. That's why I prefer to give combination of treatment when it comes to the holistic face, right? So if I have to cover the entire face, I have to map out this thing. It's not about only just correct
Only just that.
this small one portion.
True.
Because they all are interrelated, right? So filler is a quite not majority of the people know about fillers, you know.
Right, right.
And they get scared too.
They are scared. They are scared because pehle, I think when it just arrived in India, the technology, I think that time it was still going through a lot of changes. But right now, currently, we can say that we all are in the same hands and when it comes to the products and all of that. And then it does have a little bit of collagen, is what I've heard,
Correct.
which enhances the skin, right?
So it's not about it doesn't have collagen, it builds the collagen.
Builds.
Once you inject it. So filler, let me tell you about fillers. So fillers are like hyaluronic acid. Commonly, 99% clinic, they use the hyaluronic acid based fillers. There are other clinics you will find fat transfer is another way to fill the area. But preferably, these fillers, hyaluronic acid, they are more controlled because you can decrease or increase them. You can tweak them, right? So let's say you did some procedure, you felt that it's too obvious now, I want to reduce it. You can get its hylase. Hylase is an enzyme which dissolves the filler. It can get settled down as well. So that control is there with fillers.
So what about those hyaluronic acid tablets?
Hyaluronic acid tablets, the tablets I'll not recommend them because even in the collagen, if you eat the collagen, it's not going to directly build your skin.
Correct.
It's not like that. It doesn't work like that. There are roughly 7 types of collagen in our skin only.
Oh.
Yes, 7 different types of collagen.
So you don't know which one is working.
Yes, you don't know which you are getting and you're getting absorbed. So
Right.
that information is missing, right? So I assume you saw the ads on collagen and they just start buying it out,
Right.
start doing it. No, it's not like that.
Not like
This is recommended for a few things, but it's not directly. It's not going to be like take care of your fine lines, wrinkles. It's not going to get happen, right? So be cautious when you are buying something and when you saw the ad, you have to just dig around and you have to just get some information, then start using it. Regarding the fillers, it's amazing. Hyaluronic acid, it's a natural sugar molecule. When we inject into the skin, nothing reacts to it.
Correct.
So you get it done, it's a natural process. It's there already in your joints. It's already
Once you get this done, I don't worry about what people think because I think it's a beautiful thing where you can आज है हमारे हाथ में टेक्नोलॉजी तो हम ये क्यों नहीं यूज कर सकते हैं लाइक एंड एनीवन वांट्स टू लुक बेटर if it adds more to their confidence. I'm
Correct.
completely in no sync with that idea.
Yes, so see, definitely it helps, specifically when it comes to the professional life. It matters a lot, right?
And not just actors, I believe any
Anywhere,
professional,
any
right?
professional, corporates, doctors, even us, everybody needs them. The reason is because when you do this, you become more confident. That's the first thing which is absolutely right, and there are studies for that, right? So there's no doubt about it. वो impact करता ही करता है. Career की growth में आप देखें आज भी actors, we have Shah Rukh Khan, we have a lot of A-listed actors, right? And they doing it from long back. They're not started just now.
Correct.
वो बहुत पहले से ये कर रहे हैं. So आज जो आप जो generation जिसमें है, we can also reach to all those levels of aesthetics specifically. कि at that age we will be more youthful. We can get all those roles around us, and that really helps, right?
Correct.
So ये सारी की सारी चीजें कहीं ना कहीं add on होती हैं professional part में. For me as a doctor, I have to treat many, right? So मुझे भी evolve होना है. ये aesthetics है, इसमें हर साल हर महीने कुछ ना कुछ नया होता है.
होता ही रहता
होता
है.
ही रहता है. So like fillers are from long back and they are very safe hyaluronic acid. न्यू ट्रीटमेंट्स पे मैं बात करता हूँ जैसे कोलेजन अभी हमने बात करी ये अभी रिसेंटली लोगों ने उसको इंजेस्ट करना शुरू किया है पाउडर फॉर्म में इट्स गुड इफ दे टेक इट फॉर वेल बीइंग बट डोंट एक्सपेक्ट मच
Don't expect much out of
Not much out of it. Just see if it's work for you, it's fine. But don't feel that it will take care of your.
But then is there any other way to boost the collagen in terms of treatments in your clinic?
Yes. So if you want to really boost the collagen, you have to target the area, which part of the skin you want to work upon, right? So let's
What does
say
exactly
I want
collagen
you-
do to your skin?
okay. So collagen is basically your skin is made up of 80 to 90% collagen. Means your majority of the bulk of the skin is through collagen only. In that material is there, there will be more strength. So it provide strength to your skin look more firm. If you have more collagen, less scarring, less fine lines, less wrinkles.
So just make me understand how if like मैं तो वो collagen supplements ले रही थी but then now you said that it will take maybe 20 years to see the result. So how do we boost our collagen?
So collagen boosting, it depends on which part you are going to be targeting, right? So face, specifically mainly some basic pants and everything, the feet.
Correct.
Oh, the face definitely majority of us look for the face only. Fine lines to prevent wrinkle or early aging. The first thing we have to do is have a night routine of retinol. That is going to give strength to your skin and it actually helps a lot. Retinol must. Second thing, you have to do some sort of vampire facial.
Right, I've done that. Yes, it's one of the most exciting actually. Exciting actually. Because the names, this also I got to know in Miss India only because they took us to a clinic and that's where my first ever skin clinic visit हुआ वहाँ पे and that was in Malaysia.
Malaysia.
Yes. So वहाँ पे then we learned about this. It's a very beautiful treatment, right? They take your blood. They take a blood sample and then they put it in that machine which the plasma is then extracted.
Correct.
And then that is being like, the plasma is being inserted, it's injected. Injected is the right word onto your scalp. So it looks very scary when the doctors or the clinics they put this video, but it's actually very soothing because each point of your head feels like it has been, ruptured and repaired.
Okay, so now the procedure is very smooth and
Right.
now what we do is, so you're talking about hair PRP here,
Right.
which we do the plasma.
Right. And also we do it on the skin also.
Correct. Yes, known as vampire facial. Correct. If you do it on face, it becomes facial. When you do the scalps, it becomes treatment.
Correct.
So on the scalp, we do as a hair PRP treatment. Definitely, you rightly said you somebody is pinching it out. It happened before, but nowadays the process is very smooth.
Oh, really?
Yes, we blum the sensation zero. So yeah, correct. But you rightly said that PRP injection the most painful injections, and unless you don't give anesthesia there, it's not going to happen.
not going to happen.
Yes, otherwise, it will be terrible pain. I've seen people who have done it without anesthesia. They complain pain for 7 days, which you cannot afford nowadays, right? So for this, you have to first block the sensation for the scalp, but local anesthesia definitely, which is very much safe.
The cream.
And then injections too. But
Injections.
yeah, but doesn't hurt much.
Okay.
So you use vibrations to divert the mind because the liquid anesthesia is thin. So when we inject it, it doesn't give you that pain. There's a stretched nerve ending. But when you do PRP afterwards, it's become painless.
It's
Right.
painless.
And you go back normally. Your lifestyle will be the same, and you don't need to have any downtime after the
Correct.
PRP.
Correct.
But for the vampire facial, you asked me how to build a collagen in the face. So vampire facial, I recommend to do it every 2 to 3 months interval, at least 4 to 6 sessions in a year. And the reason is it involves microneedling, which helps in collagen building. Then we inject PRP, which again helps in collagen building. And you can do additional serums and nighttime application of retinol. All these ways you can definitely build more collagen to your skin.
Correct.
Rather than just taking oral collagen and just feeling that this is going to take care of your fine lines and will do the job similar to this, it's not going to be.
It's not going to be.
Yeah, ऐसा नहीं हो सकता. जो चीज जिस चीज के लिए स्पेसिफिक है उसी से ही आपको उसको ग्रोथ मिलेगा. So collagen is a nice product to have it. Benefits here में. You can have certain prevention of hair loss. You can have this, right? Some building collagen, but not to that strength as the procedure does.
Okay. I wanted to ask you as a very layman, like forget that I'm an actor, forget anything because see we are blessed with we can get this treatment done. We have all the resources, all the kind of money to do all of this. But we all know that all of this takes a lot of money, right? So now, just as a layman, I would like to ask you, just give me one simple budget every month. Okay, as a girl or a guy or anyone from this, where के ये महीने का ना तुम ये budget side में रखो for your skin, like because अभी तक यहाँ पे कोई मेडिक्लेम इश्यूज तो चालू हुए हैं, मेडिक्लेम्स तो चालू हुए
वर्ल्ड में नहीं है
वर्ल्ड में नहीं है, राइट?
नहीं, aesthetics बनी नहीं तो everybody like banks will be like bank हाँ who pays
True.
we will abuse them हाँ?
No, but then we have to, like, I just wanted to know as a layman, as I said, that every month आप मुझे बोलो कि दिव्या आप हर महीने ना दिव्या, this is the budget that you need to keep aside for your treatment.
Okay, so I'm going to add 3 advice here, right? So there, the budgeting basically the costing, how you go for the
Correct.
cost, right? So definitely, as you said, in acting, everything, there are a lot of ways to enter into, right? And then you can plan accordingly, right? So that way, first of all, you have to just map out your primary concerns, right? You
Okay.
have to fix those concerns. Let's say if you have acne issues, you have blemishes, you have fine lines, you have something, right? So first you need to prioritize that part because that's going to help you directly, right? And for that, you can start with basic treatments. So there are treatments which are basics, like for the pigmentation, we have basic serums. For advanced treatment, we have peels. For more advanced, we have lasers. So there are divisions of
There are
different steps to follow that. So you can start with basic routine as per your budgeting, and everything works. Trust me, everything works to a less or more extent. And gradually, when your pocket allows, you can go for all those advanced treatment if required. Right now, the budget. I say skincare budget. If you have few bucks, 5 to 10,000, 5,000, I'll say for a
And
small
to
budget.
keep it
Yeah,
aside.
to as a for the products on maintaining your good hydration, the skin, good products, skincare, good face wash, shampoo. I'm considering everything, shampoo to conditioner to everything. So that 5 to 10,000 budget is usually should be kept. Yeah, 5 for basic care, and if you go for 10, we are targeting something else.
Something else.
Yeah, something else.
Yeah.
Coming to the treatment budget, it can go to any extent.
Any.
Yes,
Yeah.
depending on the clinics which you choose,
Correct.
doctors, the experience involved. So उसमें again आपको वहाँ पे prioritize concerns को पहले करना है. So you should educate yourself. You can save a lot of money, right? That's truth. Otherwise, so let's say you want to do that, the thing can be fixed with 1 ml of syringe, right? Or 2 ml of the syringe. You might end up getting 5.
Right.
You know that. So first, just educate a bit कि कितना मेरे लिए रिक्वायर्ड है एंड थोड़ा सा उसका स्टडी करना है और ये ट्रीटमेंट सही है भी या नहीं. तो ये सारे आंसर्स आपको एक ऑनेस्ट
It is an honest conversation. When I came here, you told me. So I thought okay, it will be very nice for my fans because we all are very confused as to कि अगर क्लिनिक में जाने से भी मेरे कुछ काफ़ी फ्रेंड्स हैं जो इंडस्ट्री से नहीं हैं तो दे आर वेरी स्कैर्ड टू गो टू द क्लिनिक्स. दे आर वेरी लाइक अरे वो तो महंगा ही होगा. लाइक दे हैव दिस नोशन इन देयर हेड अ लॉट.
यस
या
सो मुझे एक है एक कंसर्न. मुझे मैंने देखता हूँ कि जब भी एस्थेटिक इंडस्ट्री में स्पेसिफिकली द एंटरटेनमेंट इंडस्ट्री, राइट, कुछ लोगों के ट्रीटमेंट बहुत अच्छे होते हैं, कुछ लोगों के ट्रीटमेंट को पता नहीं चलता और कुछ लोग के बहुत ऑब्वियस हो जाते हैं. लेट्स से टू बी डज द सेम द ट्रांसप्लांट, राइट, दे आर गुड, राइट, दे डोंट हैव एनी प्रॉब्लम मनी एंड दे आर क्वाइट विजिबल, बट उनका आपको हेयरलाइन दिखेगा बिल्कुल फेक और सम वेग सॉर्ट ऑफ थिंग एंड दैट हैपेंस द मोस्ट. उसके रीजंस भी है, right? So have you seen notice all those people as well?
Yes,
Because more
of course.
there's some stories.
There are many people I know, who they use a patch, they use all of these things to enhance their beauty. I don't find anything wrong, but I feel like if they have a proper medical assistance first
Correct.
before they go to these shortcuts,
Yeah.
I think naturally what we can do.
So wigs and artificial is good because they can hide something. For there's the professional requirement, but I'm talking about they got some medical treatment done
And then the hair thinning and everything
Yes.
starts.
So yeah, so something which is more become more worse by doing something. So that also happens, right? I'm talking about this, and I've seen cases where people end up having straight line hairline appearance, and that become more obvious. So you can save all this, but we're using by educate yourself.
Right. So like when my father was alive and he got his first heart attack, and then when he started taking all those medicines for heart attack, then we all noticed that his hair is thinning a lot, and we could see his scalp. Now, like for people who are watching this podcast, I would like to know that if they go through something like this where they have to go through a very intensive medical prescription, then they have to get through this. So then it is better to consult you also, so that people can start taking care of their appearance as well as their
Yes.
the problems that they are going through.
Yes. So there are reasons, let's say any chronic disease happen. It can trigger the hair loss. Anything which is coming stressful to your body can lead to hair loss, can impact your skin. And you definitely come out of this problem because heart issues are there, you get some medication. Similarly, people suffer from diabetes a lot, hypertension a lot. And all these things, they cause early aging. They cause a lot of problems on the skin and face. And
So we can still save that.
yes, we still can say that. And we and it's usually there are a lot of treatments which you can do for all those things. There are basic treatments which you can help.
पर वो आपको शुरुआत से ही करनी पड़ेगी. That's how
Yes,
the
at the right
condition.
time, yes, you can start them. You just need to go to the doctor, just discuss in detail, and don't hide anything. Just tell them whatever you're feeling, and you get a solution. So sure. So nowadays we have solution for balding. Then we have surgical solution. We have PRPs. We have medication which can at least stabilize them. So depending on your budget, you can choose your treatment plan. But yes, everything is treatable. Majority of them is
Majority of them is
yes. So if you do it at the right time, you can save a lot of money as
Yeah.
well as you can save your aesthetics as well at the same time.
Correct.
Right?
Because that gives, I feel, उसके बाद जो एक confidence जो मतलब जो टूटता है after a chronic disease or after you come to know that you've gone through something, उसके बाद फिर then you see your beauty also like fading, तो उसमें फिर आधा बीमारी तो इंसान स्ट्रेस में ही वही चला जाता है कि I am not looking the same, I'm not feeling the same.
Correct.
So if one part of it can be sorted,
Sorted.
so you feel better.
You feel better, 100%. And there are treatments. There are very safe treatment which are available. And aesthetic is purely about safety. You go for non-surgical treatments, always the safe treatments across the world. And you might heard about many good treatment. Yes.
Uh-huh.
Yeah.
Yeah, exactly. Talking about this chronic diseases, let's move on to. I've heard, I don't know if it's true or not, but glutathione was, firstly, is glutathione or glutathione?
Glutathione, basically.
Thione. So, glutathione is arrived from the treatment and the course from the cancer. Is it true?
Okay, so let me tell you, there's a story behind
Yeah.
here, right? So there are the clinics who were giving trials, high dose of glutathione to a cancer patients, and why they were giving it because glutathione is the strongest antioxidant in our body. So our body has
Liver cleanse.
yes, yeah. So it already detox our body in a way, right? So it's already there. So that molecule is very safe for the body. It's not something which is being right chemically formulated.
And excess is flushed out of the body
Yes,
also, right?
yes. So this molecule was already existing. They tried for curing the cancers, and they realized it is also working for skin. And how is making the skin lighten up, right? So people started trying for this, for lightening the skin up, right? It works. I say it works in high doses. Definitely, you have to give some high doses. You have to work on entire body to lower the pigmentation down,
Correct.
right? Your liver has a capacity, a set capacity to store that much of the good stuff. If you're going to abuse it, it can give you the side effects too. So it's nice.
Anything excess is wrong.
Is anything wrong. So if you are doing it with a proper dosage and the doctor is there to advise you and you're doing it properly, it really works. It really works amazing. But it's not a complete treatment.
Correct.
Right? You have to do it again. That's the one thing. After some period, maybe year after.
Correct. And people think एक आध बार ले लिया तो फिर तुम मेरा 4 शेड का हो जाओ. ऐसे भी होता है, I've seen. But more than that, I've taken it only once in your clinic only. But what I noticed is like the even tone of the skin. And the एक shine आ जाती है. हाँ. So you don't need to use highlighter, girls, if you go for the glutathione.
Trust me, that's the first thing people notice, that you get some shine to the face and you get some even tone, as well as your hands and your feet start lighting up. That's the first. If you do it, you'll see that they are getting lighting up. It's come a little later, but yes, this lighting up that come early. Regarding the glutathione, right? So safe तो है, ये तो हमने डिस्कशन किया. हाई डोज में लेंगे तो बहुत ज़्यादा प्रॉब्लम तो नहीं होती, तब भी हो सकता है. लेकिन इसको कॉम्बिनेशन के साथ यूज करना है, डोंट यूज इट एंड राइट, सिर्फ ग्लूटाथियोन से कुछ नहीं, आपको vitamin C's, diet routine should be good, your sun exposure should be minimal, do some peel sessions too just to enhance it. So ये सारी की सारी चीजें एक तरीके से फॉलो
So you feel, so it's safe to say that you go and walk into a clinic and then वहाँ पे जाके they'll map out the whole journey for a whole year कि आप इस महीने ऐसे करना है फिर हम ऐसे proceed करेंगे, like how we do it, how we do it, yeah. Like हर एक चीज की बारी आती है, she guides me with that. So that has made my life also very much easier because it's not like what I see on Instagram, आज ये देख लिया तो चलो ये तो try करना ही है, then go from one clinic to another.
Yes.
And then
I have a question for you here. I think you must be coming through a lot of terms aesthetically that can be done, like Korean skin, skin. Then it comes to a lot of information it's reach out to you, right? And how you manage to, let's say, this is something which I need. Have you realized anything like मुझे ये चीज करनी चाहिए?
in my body, like about skin and everything. Yes. But with time and again, and the kind of hormones we go through, girl, some days we feel like we are the most beautiful woman on this planet. Some days we feel like there's nothing we want to do. I just sit at home with a bag of chips and watch something
Great.
romantic or something emotional. But when it comes to all of this, yes, there have been times when I've noticed that if I'm under stress, my hair, my nails, and my skin, all three get affected very drastically.
Drastically.
Yeah.
Yes. So this is very true. Aesthetic is not only about a routine. It's only about keep a watch on your features, how your skin is behaving, which week, which day. It matters to that skin because the things can switch in instant.
Right.
So that's the one thing you have to keep a watch on your features. You have to keep watch on skin quality.
Right.
Coming to the terms which you come across daily basis, glass skin and some fancy terms, a lot of things are there, right? We first have to sit and understand the science behind it, right? Need to go as you mentioned, the collagen to MNRF to collagen building. We discuss a lot in this small podcast where we have touched a lot of
Nice topics,
like pillars and a lot of excitement is there because a lot of exciting treatments are coming nowadays.
Correct.
So vampire facial was there, right? Now there are other
Now we have Korean glass skin
Korean glass skin treatment, right?
When is Kara introduced? History.
So Korean glass treatment, personally, they're not exactly as a name to say. Some of them you'll find and it looks like Korean glass treatment. It's some treatment. It's not exactly a treatment. It is like how the Korean regime they follow, like the products of the Korean companies. And definitely they have some advantage because there's setting is a good industry there. And Korean products are really nice and their machines are
But also the geology also matters a lot in this, right? Because in Korea, the weather, the kind of weather they have, and the kind of weather we have in Mumbai, let's just not compare it.
Not compare it. Because skin is also different. Their genetics is also different.
Genetics is also different. Pollution plays a huge role.
100%. And people think that something is working for that person, it will work for you as well. It's not
It's
true.
not
It's not true. So your skin maybe need different sort of regime. And you have to discuss with your professional. That's really required. Now coming to again the Korean glass treatments, and there are some similar treatments which are coming. So at Kara Clinic, I ensure that whatever treatment we are doing here, it should be result oriented, backed by strong science, right? You should deliver something, right? You cannot just create the hype. There's some salmon facial swamp picture, right?
But that
is also there.
But I've heard that if your skin is burned, then the sun skin really repairs it very well.
Yeah, so this
Like
is
again, Instagram reels. I don't know the source is true or not.
so the source is not there, right? So it's not there. So it's not an FDA approved treatment at all, and it contains some sort of DNA, right? Some sort of genetic information from a certain animals, right? And you don't want some other DNA to be injected into yours, right? And so, right, so
Yeah, mutant ninja or something.
see how that COVID vaccines, right? Side effects. That's just mRNA.
But are there any side effects of COVID vaccines when it comes to hair and skin?
The studies are there, and not about hair and skin specifically, but heart. They're coming issues, right? So that's there, that vaccine having some genetic information causing all these things. So same as salmon fish too. So if some genetic information is coming, we don't know how it's going to react. Your body is going to react to it. So just don't directly jump into it until unless you get some clarity. Yeah, this is doable and it's safe for me. I think for those facials, those facets, you have to wait and study a little about and then start doing it. Don't feel that it's something new come and I'll jump on. It should not be like that.
And in Korean class, so Korean rice water treatments and all of that was also doing.
Yeah.
Does rice do anything to your face?
See, this is an ancient sort of treatments, right? And they have their methods. Lactic acid has been used. People used to take a bath with the milk, and right, a lot of things are already there in the past. So you can take something for that and just can try and then it's safe. It doesn't work, stop doing it. So home remedies specifically, I want people to be a little bit more cautious. If it is safe, not irritating to the skin, not burning or and you can try. Definitely, this for trying it is no cost, no harm, right?
In trying.
Yeah. But considering that that will be the end thing and it will really take care of all the problems, no. There are certain conditions where they need to be addressed and it can be treated either through medication or some treatments. Yes, this happens. Any exciting treatment you have recently heard?
I want to try. Have you seen? I don't know what do you call that treatment, where there is like a stitching sort of a thing in the skin. Like a laser है and then there's the dot करके square जैसे होता है and it just like shrinks. Oh, beautiful shrinking that's happening. And it looks like the skin is going through a lot, but I think it repairs itself and does that. What is that treatment?
Again, it is something which is we have come to the reels, right?
Yes, of course, sir. We all have.
Shows up information to the rest. Understood. So basically, what exactly it's happening here? They are burning the superficial epidermis, right? Which we do in Indian skin, we do with the chemical peels. We dry them out, right? But if you see, majority of those videos are from foreign countries, and they are very white skin. So if something like it burn there, it heats
Becomes like that.
yeah, and it becomes more red a little bit, then gets normalized. They don't get the blackening afterwards. But in Indian skin type, if you do that kind of damage to your superficial layer, that will lead to the PIH, post-inflammatory hyperpigmentation.
Okay.
And that will turn black.
Oh my
That
god.
might may take 3 months, 5 months, maybe sometimes it would not disappear completely. So while doing that kind of shrinking, right, everything burnt, right, or shrinks, don't fall for immediately again because it can lead to some sort of permanent damage as well.
Oh my god, that's why. See, you just don't see anything and then just jump. But I was kind of excited.
Treatment, right? So
It's
good
a good
treatment for white skin specifically. It really take care of these wrinkles and it gives you firm skin.
Yeah, like collagen will the pura loose skin stitches nicely.
Yes.
Like that.
That's amazing treatment. We say skin rejuvenation. Right? So we do with in Indian skin, we do with the CO2 fractional lasers. Which rather than shrinking the entire epidermis, we did dot, square, small white black dots, but they don't shrink, right? They stay there, right? And they don't go down.
With time,
It time this heats off and epidermis it becomes normalized. That won't leave you much of the PIH issue.
correct.
But this shrinking the skin and the plasma pen treatment sort of thing, that definitely can cause this.
Right.
Another treatment which I feel like people apply one carbon. Sorry?
Those face masks and
Yes.
red light treatment.
Yes, light treatment. So people feel that they applied a black powder or the cream on them, they become fair with this. So it's not a treatment for fairness, trust me. We do also, we apply a carbon peel on the face. We try to lower down the oil, the acne. And we target with a pico laser. It helps, right? But doesn't make you fair. For fairness, definitely
There is some obsession with this. Some crazy obsession. I just wonder, but yeah, we cannot eradicate
that.
so soon.
Yes, but we can help the skin to become more lightened up. That's true. But you cannot be some different personality.
Correct. Now, my husband, he has dark and you've met him. He does treatments from you and
He's a very good looking boy, handsome.
thank you. No, really, but that's what I've noticed. Like, no matter what skin color it is, but when you actually take care of the skin and the kind of quality the skin shows, then all those जो टैबूज है ना दिमाग में वो दिखते ही नहीं है बिकॉज अपूर्वा रियली लाइक मैं मेरे को अलीना मैम बोलती है जो मैं 1-2 बार करती हूँ फिर मैं वापस रह जाता है बट व्हाट यू टेल हिम टू डू लाइक इन अ हाउस देयर आर स्पेसिफिक थिंग्स केप्ट और वो बराबर वो यूज करेगा सब कुछ विद रूटीन और मेन आर एक्चुअली मोर सिंसियर हम 10 चीजें देखते हैं और 10 चीजें ट्राई करते हैं वी गो ऑफ द ट्रैक so they don't fall for reels, you know. They go to the doctor.
for doctors.
He doesn't.
100% true. So the women, what I feel, they go for more luxury, premiumness, right? Men are more rough, raw. They usually they think few thoughts about it, and when they convince with certain facts, they
Right.
really go after it.
Right.
They don't get influenced by
Correct.
their surroundings, right?
Correct.
So that's why you're right, Apua. He's just into few things and focusing.
वो फोकस करेगा आपने जो बोला वो बराबर वो करेगा एंड देन लाइक ही आल्सो टेक्स दोस ग्लूटाथियोन तो उसका कोई शेड ऐसे 10 शेड चेंज बट एक ग्लो आया है देयर इज एन इवननेस इन हिज स्किन टोन कैन इट लुक्स वेरी मच
You
नाइसर
look more fresh, right? So there's a difference between so there's a bit difference between toning and lightening.
करेक्ट
So lightening means your skin is getting more lightened up. And you see, there's a people like somebody is coming from what do you say, from Western world, right? Their skin is more white, right?
करेक्ट
But their skin is very dull. They don't have any luminancy, right? They don't brighten up, right? They look very dull. On the other hand, somebody is coming from maybe some regions of Africa's, and they have very good quality
वेरी गुड
skin.
क्वालिटीज
I think you love like
Yes,
as that
yes.
skin, right? And that glows well, and it really matters.
Exactly, that's what I'm talking.
Yes, so these things matter. Skin is like a balance of not only the pigmentation, it's a balance of pigment, it's a balance of your hydration, and a lot of factors are involved entirely.
Correct.
Now, my last question to you. You're being to a stage now. I want you to understand how you're going to plan your skin or hair routine. How do you do that at the moment?
Yes,
And what's your goal now?
So I know one thing, I don't forget my sunscreen. It's like my first go-to thought when I start touching my face. When I have to go out 20 minutes prior to my makeup, I do that. I sit with it. And then I start my makeup. And I don't use these so-called branded luxury moisturizers. I simply use this tube called Emoline. आपको medical से मिल जाती है. Emoline is what I apply for my moisturizing things. And then उसके बाद रात को सोने से पहले is the main thing that I do is like I clean it properly with a good oil removing all the makeup. I don't want my pores to hold makeup. And then उसके बाद then I do the toning. And then last में सोने से पहले a night cream which only you guys only suggested which is a medical night
Correct.
cream. Not some luxury brand which is I'm paying like 3-4 thousand for one cream. आप लोग जो देते हो it's so nice and so pocket friendly yet it is like you know
It helps.
it helps
Definitely.
I can feel that.
Yes. So basically, what I'm going to say is, when we are like exposed to cameras and everything, we have to maintain our skin in a different way, and we don't want fine lines and wrinkles
Correct.
at the early age.
You tell me what can I add? And also I've started doing this sir the face dip in the ice water in the morning. Does that help? Yeah, ऐसे ही है.
Yeah. See, I say you can try them out. If unless it's not costing
Right.
anything, I
Right.
to us, but so I say don't go for it. If it's not making your skin more harsh, it's not a harsh treatment, sensitive नहीं है, damaging नहीं हो रहा है, so you can try. That's it. Try for weeks, 2 weeks, doesn't matter, right? If it helps, even we get some information out of it. If you ask about the science behind it, it's very, very rarely you find any science behind all these treatments. But it may or may not work. I cannot say at the moment, but just keep trying this because this is not causing any harm.
What can I add in my routine?
Routine. Okay, so see, definitely lights are something which cause more of the problem. So sunscreen, which is a must, which you're already doing it. Face wash, moisturizers, everybody does that. Toner as per the requirement. If you need to do this, scrubbing. Avoid scrubbing if you have some acne issues, right? Otherwise, you can do it.
You can do
Next thing is when you're doing this, the night cream, specifically ensure that you are having a retinol, which I always tell.
right.
Other than that, niacinamide, it helps, right? Have some antioxidants in your diet. That is important. So,
Like blueberries.
like blueberries, either you can take some fruits through the nuts or through the antioxidant tablets which are there. Isopine is something which I recommend, but there are a lot of other antioxidants too. There are new molecules. Always there are new molecules that are coming through. So antioxidant is a must thing. Omega-3 fatty acids.
Yes, omega-3 is also
Yeah,
I use.
it's a very
Yes,
nice
true
product
call,
for
yes.
skin. Other
I'm a vegetarian, but I use omega-3 as tablets because it's medicine.
it's
You have to
medicine,
have it.
100%. And vitamin A and vitamin E, they are also
E is the Evion.
yeah, you can use it.
In
They're
there.
very safe, good, easily available, and you can have that routine with you, and you can at least start with the basic. Other than that, then there are so many things to apply for pigmentation, for correcting the fine lines. There's so many things you can add on to this, but this is something which is basics. Vitamin A, E, and all sort of vitamins, right? Really helps. Good diet definitely helps. Routine sun exposure, what is sun exposure, chronic sun exposure should be there.
But then for vitamin D3, you need the sun, right? So how do we balance that?
Yes, so there's a way to do this.
Right.
So what I do, or I say, you have to target. That's a face, right? You have to put it that with sunscreen, right? You go out with it. But your body and other parts, you can
That can absorb
absorb the vitamin, right? So don't completely knock out yourself, right? You're not going to both yourself. You should go there. Check your vitamin D3 levels. If you find that
they're always low for me.
yeah, well, I understand because of lifestyle, so matters. So majority of us have the vitamin D3 low side, but you can add supplements, right? So there's supplements which can help you in this. Other than that, have some exposure, let the hands and take some bath and take some vacations. It can also help you. So many things you can do that for this. Right?
So to cut it for a short reel, as a routine, you have to use sunscreen, you have to get your blood work done every 6 months to know where your vitamins are. And then you have to do a night routine is a must.
Correct.
Cleansing your face is must. All these small, small things. And then also have a doctor who's guiding you properly. That's very important.
100%. It's good to have you, right?
It was a good
Great podcast. So,
You did it.
we discussed a lot of things. We did a lot of work, right? And this happened just like this only.
I know, right? See, easy.
As easy, yes. So, I think this podcast we shared a lot of information, there were a lot of insights about Divya's, her routine, her aesthetic journey, my recommendation and advices. So, we close this podcast for now. Always please stay tuned. Keep watching us. Thank you so much.
Bye, guys. Bye, guys. Thank you.
Bye, everyone.